7 dangerous diabetes. Nighttime signs you should know. Diabetes can present serious health risks, especially at night, when symptoms may go unnoticed. For individuals over 50, nighttime complications can become more frequent and severe due to age-related changes in metabolism and overall health. Blood sugar fluctuations, nerve damage, and other diabetes-related conditions can disrupt sleep, leading to long-term complications if not properly managed. Are you aware of the warning signs your body might be giving you while you sleep? Understanding these dangerous nighttime signs is crucial for preventing health emergencies and ensuring a good quality of life. Are you waking up sweaty and confused? It might be nocturnal. Hypoglycemia. The condition known as nocturnal hypoglycemia, in which a person's blood sugar levels drop to dangerously low levels while they are sleeping, is one of the most worrying nighttime difficulties for diabetics. As a result of the fact that it frequently takes place without any obvious signs until it becomes severe, this can be an especially deadly condition. How often do you find yourself bathed in sweat, feeling wobbly, or bewildered when you wake up? Dizziness, nightmares, a rapid heartbeat, and seizures are some of the symptoms that can be brought on by hypoglycemia that occurs throughout the night. It is frequently brought on by taking an excessive amount of insulin, missing meals, or participating in strenuous physical activity in the hours leading up to bedtime. If you have this occurrence on a regular basis, it may be time to make adjustments to your medication, consume a light snack before going to bed, or make use of a continuous glucose monitor, CGM, to monitor your blood glucose levels and receive warnings when they dip dangerously. Do you wake up thirsty and tired? It could be nocturnal hyperglycemia. In contrast, nocturnal hyperglycemia, which refers to elevated levels of blood sugar that occur during the night, is also a significant cause for concern. Have you ever woken up with a headache that was giving you a pounding sensation, a parched mouth, or severe thirst? Your blood sugar levels may be too high if you are experiencing any of these symptoms. Numerous individuals who have diabetes suffer the need to urinate frequently during the night, which causes them to have trouble sleeping and leaves them feeling weary the following day. Additionally, persistent hyperglycemia can be a contributing factor in the development of significant consequences, including renal disease, nerve damage, and cardiovascular issues. If this seems familiar to you, have you given any thought to monitoring the levels of sugar in your blood before going to bed? The avoidance of late-night meals that are high in carbohydrates and the modification of medication may be helpful in preventing these surges. Do you snore loudly or feel tired, even after a full night's sleep? Sleep apnea might be the cause. A dangerous disorder known as sleep apnea occurs when a person's breathing continuously stops and resumes while they are sleeping. People who have type 2 diabetes are more likely to have it than other people, since it is frequently associated with obesity and insulin resistance. Your noisy snoring is a source of frustration for your family members, right? Have you ever woken up feeling extremely exhausted or gasping for air? Have you ever experienced either of these things? It is possible for sleep apnea to result in excessive blood pressure, heart disease, and a worsening of the ability to control blood sugar levels. A sleep study may be required if you have any reason to think that you have sleep apnea. Treatments such as continuous positive airway pressure, CPAP therapy, weight loss, or changes in lifestyle can dramatically improve your quality of sleep as well as your general health. Do your legs feel restless at night? It might be a sign of nerve damage. If you have ever experienced a tingling or crawling sensation in your legs throughout the night, which made it difficult for you to fall asleep. What was your experience? It is typical for persons who have diabetes to experience restless leg syndrome, RLS, which is frequently associated with diabetic neuropathy, which is a form of nerve damage. The inability to control the need to move your legs is a symptom of this problem, which becomes more severe when you are attempting to rest. If you have difficulty dealing with these sensations, it may be time to consider prospective therapies with your physician. Some of these treatments include better management of your blood sugar, improvements in circulation, or the use of drugs that have been given to you. Do you wake up drenched in sweat? It might be diabetic. Night. Sweats. In the absence of any evident cause, increased sweating during the nighttime hours may be an indication of fluctuating blood sugar levels. When you wake up, do you ever find yourself drenched, feeling chilly and clammy, or suffering shivers despite the fact that the environment is warm? One of the most common causes of night sweats in diabetics is hypoglycemia, but in certain instances, night sweats might be the result of autonomic neuropathy, which is a disorder that affects the sweat glands. In the event that you see this pattern, have you checked the levels of sugar in your blood before going to bed? It may be possible to prevent these attacks by making adjustments to your diet or medication. Do you get up to urinate multiple times at night? High blood sugar might be to blame. Having to urinate frequently during the night, also known as nocturia, may be an indication that your blood sugar levels are too high. During the course of the night, have you found that you are waking up multiple times merely to use the restroom? The kidneys have to work harder to eliminate extra sugar from the blood when glucose levels are high, which results in an increase in the amount of urine that is produced. The next day, you may have weariness and dehydration as a result of this, in addition to the fact that it affects your sleep. Before going to bed, have you been monitoring the amount of fluids that you consume, reducing the amount of sugary drinks you consume, and maintaining adequate control of your blood sugar levels can help alleviate this problem? Do your feet burn or feel numb at night? Watch out for diabetic neuropathy. Diabetic neuropathy is a disorder that damages the nerves, mainly in the feet, and it happens to be one of the most painful and chronic effects of diabetes that occurs throughout the nocturnal hours. If you have ever tried to get to sleep and experienced a burning or tingling feeling in your feet, what was your experience like? Others have reported experiencing a numbness that prevents them from having a normal sense of sensation in their feet. The nerves are being damaged over time as a result of chronic high blood sugar levels, which is the cause of this discomfort. Non-treatment of neuropathy can result in foot ulcers, infections, and even amputations if the condition is not addressed. On a regular basis, have you examined your feet to look for any cuts or sores? By taking the appropriate medications, taking care of your feet, and receiving treatments for nerve pain, you can help lessen the discomfort associated with diabetes and prevent problems. What can you do to prevent these nighttime diabetes risks? You might be wondering, if you identify any of these warning signs, what actions you should take to protect yourself from their potential consequences. The most important thing is to keep your blood sugar levels steady by eating a balanced diet, exercising on a regular basis, and managing your medications in the appropriate manner. Have you ever attempted to keep a constant record of your glucose levels before going to bed? When you use a continuous glucose monitor, CGM, it can help you stay informed of potentially dangerous changes in real time. Furthermore, adhering to a healthy bedtime routine, avoiding heavy meals late at night, and maintaining proper hydration are all factors that can lead to improved sleep and general health. Should you continue to experience these symptoms, have you discussed them with your physician? Neglecting the signs of diabetes that occur throughout the night might, over time, result in serious consequences. While it comes to effectively controlling diabetes, seeking the assistance of a trained medical practitioner while looking for individualized treatment, alternatives can make a major difference. It is possible to increase the quality of your sleep, lower the dangers to your health, and improve your general well-being if you remain watchful and take preventative measures. Which of these symptoms have you observed in yourself or in someone you care about, now that you are aware of the signals that should alert you? Thanks for watching. Don't forget to like and subscribe to our YouTube channel.